Hello. How are you doing? May I have a seat? Thank you. Oh, goodness. Well, it looks like you're all prepped. They took very good care of you, I see. Let's see here. Okay. Perfect. It's connected well. Set this right over back. Okay. See, just picking up your... Go ahead and take a deep breath for me. And exhale. Deep breath. Exhale. Beautiful, beautiful, beautiful. Okay, set this right back over here. So your oxygen level is 100% or 99%. It just dropped. Okay. Your heart rate is a little bit high, but no worries. Although you will be awake for this procedure, I promise you, you will not feel a thing. I see they already actually put a benzodiazepine in your IV, so you might actually be feeling just a little bit dizzy right now. Is that correct? Okay. Well, please forgive my manners. I forgot to introduce myself. My name is Dr. Karuna Satori, MD, and PS, plastic surgeon. So although I am a doctor, I'm board certified in plastic surgery, and we're just going to get this little thing right off your face, okay? It is benign. Sometimes people can grow these things and they show no danger whatsoever. So your last appointment, they did take a little sample of it. They bandaged you up very well. There is no scarring on the thing itself. But today I will be completely removing it, and we will not suture because you won't need stitches for this. We're going to actually let the skin around the face just do it itself, okay? So let's just take a look at your chart here. What I'm going to do is just go over some information, have you verify if it's correct, and then I have a sheet here. I'm going to tuck it around your arms rather than strap you down to prevent, any more anxiety, because there's only so much medication we can give. But I promise you, this surgery, I do it all the time. So many people are happy to have it off and removed. Again, you didn't ask for this. This happened to you just because of life, looking here. It appears you are pretty much in great condition. You're extremely healthy, overall adequately active. And okay, so this will not cause any damage, any scarring. I actually have a natural salve here on my surgical table. I'm going to be applying that, but I'll explain the procedure in a moment. Let's go ahead and go over your chart here, okay? Okay, so your intake looks like you've already had coming in. It is super, super early, but you will be staying the night. You'll be asleep. All of this medication, numbing, everything like that, local sedation, you'll be out for the majority of the day into the early morning tomorrow. So, but you probably will be awake. I can see your... Do you mind if I touch you? Thank you for your permission. I see you are a little bit sleepy already. So that's perfect. Maybe you'll sleep through the procedure, but we'll see. It's actually pretty fun to watch from a point of view. I've had a thing, I don't like to say the medical term for it because I like to just keep a comfort between us, but I've had the thing removed prior, actually in the same spot that you had. So actually, it would have been on this side of my face, sorry. Okay, so can you verify your full name for me? Okay, can I just see your right wrist here? Check your medical bracelet. I'm actually going to scan that, so excuse me. Pick up the scanner here. They keep everything on the floor. It's in a little drawer, so let's go ahead and scan your bracelet. Okay. Perfect. Your name and birth date has been verified, but can you tell me your birthday anyway? Standard procedure. Okay. And you are here for a removal of a benign thing on your upper right temple. They don't have the medical term, but that's fine. Alright, allergies. Potentially, it says no answer to the cillins, amoxicillin, penicillin. We actually are going to send you home with an antibiotic called clindamycin, okay? Yeah, it's just in case. It's pretty much the same as the cillins. It does actually a pretty better job. The only side effect is if you don't eat it with food, like most medications, you might get a little bit nauseous. But we will be sending you home with some strong prescription pain medication. This is not over the counter, so a script has already been written for you. Do you know your local or your closest pharmacy? Okay. Actually, do you use that naturally, or is it? Do you happen to know the address? Oh, thank you. Okay. And then I have your notes here. Patient came in weary and sick due to pain on upper right temple. Symptoms included redness around the area, large bump, bleed. Alright, sterilized. You are not sterilized right now. Afterwards, you'll be asleep, like I said. I will just go over and fill out your chart at the end. Vitals. I am going to get a set of vitals on you right now, actually. And then I will explain the procedure and we'll get right into it. The procedure itself takes about 10 to 15 minutes. That's how simple it is. It's no problem whatsoever. So let's go ahead and start with a blood pressure. Okay. Now you're probably wondering why we're using a separate unhooked blood pressure cuff compared to all the machines around you, and that is because we are focusing around your face today. We have an IV in your arm. One more machine is not going to do good in this tiny space. And that's another thing. I don't want you getting claustrophobic. You are safe with me. That's another reason we like to keep patients awake for procedures on the face, kind of, certified as a doctor and plastic surgeon. I feel it causes a little bit of adrenaline rather than injecting you with epinephrine. And we actually will be putting a little epinephrine around the area, but usually in surgeries like this, they will inject you with it, and it's not good for the heart unless absolutely required. So it's not dangerous, but in a sense, it's not necessary unless required. Do you understand? Okay. Okay, I'm just gonna get your right arm here. Perfect. Alright, so got the little thing right here, and let's go ahead and get it pumping. Ready? Just breathe normally. Go ahead. Okay, so you are the same heart rate. Okay. thank you for that. We will just get that back in the case here. Okay. Now I'm going to just take a heart rate and follow along with what's already on the screen. And you have those little stickies on you, okay? So I'm just gonna get a little bit close to you and set this right down on your chest. Alright, take a deep breath. Oh, that's not good. That's okay. It was a tool we're not using. Go ahead. And one more. Perfect. Thank you so much. We don't need the bag. You're laying down, you're comfortable. And let me just remove this little tool right here. Set it over on the used rack. Okay. Alright, so let me just write this down. And we will pretty much be in business. So, okay. Patient. Vitals. 120, a bit high. I'm using my permanent for this one, sorry. When it comes to surgeries, we like to use a permanent ink pen, so it's a little bit louder. Okay, perfect. So, put that down here. And again, I'm just gonna get a little bit closer to you. Excuse me. And next, we're gonna pretty much get along with our procedure. So all I need you to do now is I'm prepping myself. First things first, I'm going to get this ready here. Inject you. Well, I'm actually gonna be putting it outside the area so it's sucked in, but I'm going to be getting a little bit of sterilization. And then I'm going to be putting just a tiny bit of epinephrine. The epinephrine should actually be a more milky color, but it's completely fine. We have it diluted because, again, this isn't anything super big. But so you are numb at the moment, correct? Alright, I'm just going to feel around the area before I sterilize you because then I have to put on gloves. But I have thoroughly, washed my hands prior. So just getting right above your eye here. Okay. You can feel that? No? Okay, perfect. Alright, I'm going to apply a little bit more pressure. I don't want to pop it. No? Okay. Great. You are 100% numb. Trust me, there is nothing else you need to do at this point. But relax. We are going to put a little bit of pain medication in your IV just to make sure you are 100% kind of like locally sedated. But again, you've already had a benzodiazepine, so you should feel relaxed. But right now, let me just focus on sterilizing you, getting the epinephrine in, and then we'll get the pain medication, okay? So, just go ahead and get my gloves on. So I'm just going to get ready and explain to you while I'm getting ready what I'm going to do. So right now, I'm getting my gloves on prior to sterilizing you. I have the epinephrine ready to put in the thing. And following that, I'm going to just get super close to you and view the thing on your face. I'm gonna put a light on it, just see where I'm going to be making the incision, and then we're gonna drain it and I'm going to put a little bit of salve, super healing salve, around the area. And your skin pretty much immediately starts working too, just because if I pull it together and suture it, not only will you have a scar on your face, but it stretches the skin here, so later on in life it will wrinkle up, and you don't want that. I work with aesthetics and I work medically, so I'm here to help. Okay, so let's see. Let's go ahead and sterilize the area, shall we? This is just a bottle of pure 100% mixed alcohol and stone. Okay, actually gonna set this down here. Are you warm right now? Okay, we're probably gonna skip the sheet because I felt you, and if you're that numb, you should be good. So just go ahead and 1 second. Relax. I'm gonna sterilize you. Ready? Okay. It's raining outside, isn't it? Yeah, it's coming down like cats and dogs. Cats and dogs. Just getting a little bit over the eye. Go ahead and close your right eye for me. Perfect. Let's dispose of this. Apply this here. And okay. So while we let that sterilize, I'm going to just go ahead and proceed to apply the epinephrine, okay? So this will only pinch just a little bit if you can even feel it, but let me know if you can, alright? So I'm just gonna go ahead and this about right. Can you feel that? No? Oh, that's good. Great. Okay. Alright, it did squirt out on the side a little bit. So let's get just a pad here. Golden pad. Okay. Alright. Beautiful. And then next we are actually going to get the other needle here and just apply in your IV some pain medication. So what I am putting in your IV right now is Dilaudid, 25 milligrams. Alright, you may feel a little bit of tingling in your hand, okay? Anything? Oh, you are amazing. You are taking this so well, so you're actually going to get very sleepy at this point. Ultimately, we would usually put Percocet or oxycodone, but we're focusing on Dilaudid, which is usually used for pain in the stomach area, but it focuses more upper to the skin, so it's actually perfect for pain around your face. You might actually feel like you have an allergic reaction, like, you know, a cold when your face swells up. It feels really good, trust me. You'll enjoy it. How are you feeling now? Can you nod if you are feeling good? Perfect. Alright, so what we're going to do next is just move along with the procedure. I have my little light here. I'm just going to press down on the skin around the thing, and we're going to see what we can do, okay? Ready? I need to know exactly where to make the cut. Here we go. It's going to be a little bright. Okay. Right. Just going to put this right around the skin and the area. Okay. Right above your eye. I know I'm blinding you a little bit. Blinded by the light. Wrapped up like a douche to the rumor. And I think that's not the lyric, but you know what? This thing's ready to go on its own. I don't want to press too hard. We might actually not need to make an incision at all. We'll see. Now, I am giving you a trigger warning. There may just be an itsy bitsy, teeny weeny yellow polka dot bikini. Now, there might actually be just a little bit of blood, but I promise you it's the smallest amount. It's like when you get, you know, a pinprick, your IV produced more than this little guy, okay? And the reason for that is you're going to see yellow pus inside of it, but down around it, it's going to be, you know, just from the skin incision, just a little bit. So trigger warning now. Trigger warning, okay? I'm giving you a trigger warning. So you can close your eyes for it or just try to fall asleep if you'd like, but we are going to actually go ahead and try one more thing. That is, let's go ahead and use the light. Super close. I'm just zooming in right now. Okay. Perfect. Alright, excellent. So now is the actual part. I'm going to be just making an incision and then clamping. I have two sterilized tools here. One, the incision maker, the scissors, and two, the clamp. So whenever I cut, I'm just going to peel it back just a little bit, just the skin over the thing, and then clamp it with this. You're not going to feel a thing. This isn't going to cause any scarring. It's purely just what's needed to be done, and then immediately I'm going to start wiping away, and we'll go from there, okay? So, are you ready to do this? Are you sure? No anxiety? I'm actually going to put on my mask for this. We're still letting the epinephrine take effect. Does, again, is adrenaline. It helps put blood to the surface. That's another reason you might experience blood. But overall, nothing that you can't handle. Okay. Oh, you know what? Might have a little bit of trouble. One second. Alright, so I only need this to make the incision, so. Are you all ready? Okay. So here we go. Just relax. Just little scissors. Just to use to cut the skin. And the mask is purely so I don't get any secretions on myself, okay? Here we go. Okay, holding that. Second. Everything's good. You just relax. Just gonna. It would have already got the secretions by popping on me, so we don't need. Okay. Alright, we have clamped that back. Might feel a little bit of bumping right here. Okay, and immediately just wiping around the skin. Okay. Just a little bit, it's okay. Okay. See, nothing to be worried about. And then we're going to just tap away at any leftover blood. Okay, perfect. And that should be it with that. And next, all we have to do is drain it. And for that, I'm actually going to use this tongue depressant you saw. Tongue depressor. I'm going to use my thumb and the tongue depressor and push, okay? And then we're going to remove it with the cotton pad. The cotton pad. Here we go. I know it's blinding you a little bit. Okay. I know you might feel a little bit of tripping down your face. I'm sorry. should have completely trained it. Okay, just see it, it's a little bit yellow, that's completely normal. Okay, and then just wipe away with what's left. Excellent. So to finish you off, we're going to apply a coating of this. I have to unclamp the skin and immediately apply the salve, and then we're going to paint over with a coating of another salve. It's basically a liquid bandage, and that's it. We'll sterilize the area once again to make sure there's no remains of the thing or blood. So, and that literally is it, sweetheart. I told you it wasn't bad. It's not supposed to be bad at all. Set this by you. Go ahead and take a smell. I know, it's incredible. Alright, so let me just unhook this and we will okay. Perfect. See? That's how you hook them, right here. Alright. Let's go ahead and just apply it right up here. Circular motion. Let me actually get, where is it at? My light. It's gonna be a little bright, okay? Oh, good. Okay, there we go. Just a little bit of the area. Make sure I didn't miss anything. Okay. Nope. Incredible. We are doing excellent. Okay. Go ahead and get the cap on for this. Shake this up. Whew. Go ahead and smell that. Now that is adrenaline. Okay. Just gonna paint that on like it is a nail, okay? Gently painting over the area. Your skin is already starting to turn blue, which is great. That means that bruising is occurring, and that's all you're going to have. That is excellent. Your body is healing up this quickly. Now, obviously, it's going to take a couple days. Again, we have provided you with a prescription of pain medication. You take that as needed every 6 hours, preferably. This will last for about 3 days. The bruising is blue at first, maybe a little bit red. You'll see, you know, broken blood vessels and things like that. Completely normal. The face is very vascular. Your lips especially, but fast forwarding, eventually the bruising will start to turn yellow, like a kind of gross yellow, but overall you'll have like a little scratch by the end, it'll look like, and then it'll disappear completely. We do offer a brand of scar just to keep safe called Theriscar. You can get it tomorrow morning before you're discharged, and make sure you definitely keep a 100% big breakfast here. I always take advantage of the cafeteria. Even though I work here, we are able to have free food. So last but not least, I am just going to sterilize you once more. Get any complete bacteria that is potential around the area, so I'm just going to spray a cotton ball. Okay. And you are finished, my dear. You did absolutely incredible. Very surprised. Very surprised. Starry eyes surprised. Right down. Go ahead and close your right eyelid. Okay. Excellent. Excellent. Alright. Then just one more time. Let me get a light going here, okay? Grab my zoom in. Alright, ready? Okay. Perfect. Okay. And you, let's go ahead and disconnect. Cord here. Oxygen cord, you won't be needing it anymore. Alright, to get off that. I like to play with it sometimes. Doctors like to have fun too. Go ahead and remove this. How are you feeling? Can't feel a thing? You're pretty much asleep at this point. You've been closing your eyes in and out for a while now. I'm just going to go ahead and match you up with a set of vitals before I write down the rest of the chart here, so don't even worry about it. You're pretty much asleep anyway, so I'm just going to go off by your breathing. If you don't mind, I get a little bit close. A little bit of heart palpitation, nothing to be concerned about. Then one more. Okay. Excellent. You are probably one of my easiest patients that I have had in a long time. Okay. Here's the... Okay, right here. Did incredible. Surgery was a success, a fantastic success. Aftercare, we have a prescription for clindamycin, antibiotic, and Percocet, 10 milligrams, 3 days worth, 4 pills a day, every 6 hours, disposed after use, if any left, reasoning, 9, okay, excellent. So my work here is finished. I'm actually going to take this with me, go ahead and have the nurse come in here in a few moments and clean up, and that is pretty much it. So let's go ahead and get a closer look. Let's get a closer look at you. Amazing, simply amazing. All right, well, you are pretty much asleep at this point, so if you can hear me, it was super. I cannot tame my flyaways, but it was super nice meeting you, and I'll actually probably be making rounds in the morning if you're even listening. So thank you so much, and nice to meet you. You look amazing, sweetie. All right, see you later.